The healthcare system in Haiti is broken, and tens of thousands of people die every year from preventable and treatable illnesses. Nearly 60% of people live below the poverty line of $2 per day, and the maternal and infant mortality rates are among the highest in the world. As decades of political and economic crises continue, Haiti remains the poorest nation in the Western Hemisphere. Government hospitals and clinics have insufficient resources to provide reliable care to a poor population, while well-intentioned but unsystematic volunteer and missionary clinics across the country create confusion in the health marketplace. These conditions present a grave danger to Haiti's poor, especially for expecting mothers. Approximately 1 of every 80 women in Haiti will die from childbirth and pregnancy-related causes. Childbirth is often left in the hands of the women themselves, due to limited healthcare access and limited health-seeking behaviors. Only 49% of women in Haiti give birth with a skilled attendant, and only 39% deliver in a health facility. In impoverished communities where C2C operates in northern Haiti, women face multiple barriers to safe pregnancy and delivery, and babies are at risk for malnutrition and disease. Haiti also has a high rate of teen pregnancy, which intensifies risks for both girls and their children. Some 14% of Haitian adolescent girls ages 15 to 19 are already pregnant or have children. The average age at first sexual intercourse is 17 years old, and 56% of the women reported sexual debut before age 18. While it is well known that adolescent pregnancy is strongly linked to poverty, lack of education is also a strong determinant of early sexual initiation. C2C currently runs a maternal health program at 2 clinics that has been met with high demand, reaching vulnerable women with much-needed antenatal and newborn care. We have treated approximately 2,500 unique pregnant women and registered over 10,000 clinical visits. Our family planning and reproductive health services have also demonstrated a high need in our communities, with our number of family planning patients rising 5-fold in its first year. But without reliable sources for family planning and sexual and reproductive health information at schools or at health facilities, young girls and women, especially in the rural areas we serve, are at risk for early pregnancies. There is also a high reliance on traditional medicine and voodoo practice in some areas, and health-seeking behavior with regard to family planning is not a cultural norm. Ensuring that women have reliable control over their reproductive health is a human rights imperative and an urgent priority. However, we are not reaching most women until they become pregnant and seek our antenatal care. Girls younger than 18 make up 12 to 15% of our first prenatal visits, and our most frequent diagnoses across our clinic network are genital and urinary infections, including many STIs. We also know that sexual and reproductive health education is not part of the school curriculum in our region. C2C has created a new and innovative approach for community healthcare delivery in Haiti, a social enterprise model that delivers reliable, affordable, high-quality primary care through a network of clinics. C2C provides primary care, antenatal care, and family planning services across our clinics in the north of Haiti. We seek to provide culturally sensitive information and education in a comfortable community setting with trusted and knowledgeable C2C nurses to encourage the use of family planning at earlier ages. By launching a new sexual and reproductive health education program to reach young women who have not yet accessed our family planning or antenatal services, we provide them with the information and tools they need to prevent early, unwanted pregnancies and gain control of their reproductive health. To achieve this goal, we have developed a new curriculum on reproductive health information and options for girls ages 13 to 20, and pilot a 20-week sexual and reproductive health education after-school program with over 400 girls enrolled over a 12-month period. By piloting this program that will directly impact young girls and women and indirectly impact their families, C2C aims to improve knowledge, change attitudes, and increase use of family planning commodities and services among adolescent girls in northern Haiti. Our long-term goal is to empower girls and young women to reduce teen pregnancies in our catchment area and limit the cycle of poverty we see among the families we serve. For too many expectant mothers in Haiti, pregnancy and childbirth are not always the joyful events they hope for. Educating girls and young women about sexual and reproductive health will result in higher levels of improvement in women's general health, increases in female labor force participation and earnings, and increased child health. Join us in building a bright future for women's health in Haiti.